Good day, everyone. This is Dr. Ibum Ghana here. We'll continue our discussion on ways that a medical student will succeed during the period of his training. Today, we'll talk about how to pass introductory posting in internal medicine. That's for those who are in 400 level, who are currently doing their end of posting. Who are preparing for the end of posting exam or are currently doing the end of posting or are currently doing introductory posting. So we'll look at how you can succeed and pass without little or no difficulty. So we are going to look at the outline, what is expected of you at the end of your posting. We'll talk about the best of 5 questions, which is more of the previously, is multiple choice question where you either indicate whether it's true or false, but that has changed. Most international standard of asking questions in medical studies is best of 5. Then we'll talk about the essay, which is the pen and paper aspect of the theory, where you have to write and answer certain questions. Then we'll talk about the clinical aspect, which involves the long case and short case. So let's begin by talking about what is expected of you to attain by the end of your posting. It is expected that you know how to clerk a patient. That's to take a clinical history. Clinical history is the foundation of any medical practice, no matter who you are, from the most junior doctor to the most senior doctor. Taking clinical history is extremely important. So it is expected that at the end of this your introductory posting, you know how to take a good clinical history, because it's the foundation of clinical practice. So we expect you to take biodata and apply that biodata to the disease condition of the patient. So when you're talking about age, let's say you're talking about maybe 65 years and above, then we expect that you're talking about how, being an elderly, the patient is at risk of certain diseases. So the biodata. And we expect that you know how to chronologically arrange your presenting complaint to from the one that occurred some time ago to the most recent. But when you're arranging presenting complaint, it shouldn't be more than 5, because if you're presenting complaints more than 5, is crowded, right? So we expect that you know how to do that. We expect that you know how to take history of presenting complaint, talking about the cause, which talk about how the symptoms started, how it has progressed, whether it has regressed or it has not, whether it has worsened. Then you talk about the cause. What's the possible cause for the symptom? For instance, if the patient has cough, what is the possible cause of the cough? Is it respiratory or cardiovascular? And if it's either, is it from, if it is one of the two, let's say if it is cardiac, is it heart failure? Like if it is from the respiratory, is it pneumonia or tuberculosis? So that's the cause. Then you should know how to talk about the complication. Has the cough led to symptoms of respiratory failure or not, right? Then talk about the care, since presentation, the care that the patient has received. So we should know all components of history and be able to take it. Then you should be able to perform a basic clinical examination. So it's expected that you're able to do basic clinical examination, from general physical examination, central nervous system examination, chest examination, cardiovascular examination, abdominal examination. These are the minimum examination that are expected for you to carry. There are other examinations, but the minimum examinations that are expected for you to be able to do seamlessly are the major systems, right? Then you should be able to follow instruction when answering all questions. You know, the issue is it is expected that when you're being asked some question, you shouldn't go and be answering something entirely different. No matter how good you do with that, there's no mark for answering a different question. So we'll take them one after the other. So for the best of 5, it is important that, you know, maybe some of you have not come across best of 5, while some have. Okay, so best of 5, you're asked to choose the most accurate answer. It is important for you to know that you're not, it may be that all the options are right, but you are looking for the one that is the best answer. That's why it's best of 5. You have 5 stems, which one is the best? And sometimes, yes, it could be that you're looking for the right one out of the other wrong ones, but it's possible that all the stems are right. So you're looking for all the options are right. You're looking for the one that is best. So avoid unnecessary guessing. This is very important. Though some may apply negative marking while others may not, but it's important that you avoid unnecessary guessing if you're doing any posting exam. Very important. Unless you are at least 70 to 80% of sure of the answer, please do not attempt. So in as much as it's not good for you not for you to guess, it's important that you don't leave too many questions unanswered at the same time, right? You know that the minimum mark in medical school is 50, so there's nothing like D, that you score D. There's nothing like that. So please, you have to practice what you have been taught. So in 400 level, mainly none of your lecturers will go outside what you have been taught. It's usually what you have been taught. So a good student will be following all his notes and be creating some hypothetical questions. Let's say if you read, let's say, about diabetes, what are the possible questions that will be asked about diabetes? You write it out and you keep practicing, So usually at this level you are likely to be asked what you're being taught, but it's not definite, right? But likely, because you are upcoming, right? But the curriculum for any medical student before you're a doctor is the whole human body and the diseases that can affect it. So for the AC, it is important that you follow instruction. It's extremely important because some students have challenge in following simple instructions and answering what you have been asked. One of the things that we have noted is most students do not know the difference between discuss, outline, list, or write short note. It is important that you take note of that. So when they say discuss, that's the real AC. You do like you're writing an AC the way you know it, right? Where you have the introduction, where you define the condition and give small epidemiology, right? Then the body of the AC, that's the main question you are being asked. Let's say they're asking the principles of managing acute stroke. So in the introduction, you define what stroke is. In the body of letter, you talk about the principles of management of the stroke. And in conclusion, you summarize what you have said. So here, do not list. It is not listing. Discussion is not listening. You write in a paragraph form. While outline, what outline means is that you list and give brief supporting detail, right? So if they say, okay, talk about the non-modifiable risk factors for stroke, like for example, if you mention race and you said, okay, the black race have been associated with increased risk for stroke, right? Or you mention age, you say, okay, it is commonly seen in the elderly, those that are 65 years and above. So it is important to note that outline means list and give brief supporting detail. While list itself, if they say list so 5 causes of it, just list, itemize, that's what it means. Write down, itemize. Here you do not explain. You are not expected to explain. If you explain, there is no. Okay, so that's for AC. Then we go ahead and discuss the short notes, right? So for short notes, it is a summarized form of the discourse. So you summarize there. So this one is also expected that you introduce body conclusion, but it's in a summarized form. So the way you know how to summarize, this is the summarized form of the discourse. So for the clinical aspect, this is the most important aspect. Though the theory is equally important, but this is the most important aspect of the discussion. The reason being, if you fail the clinical, you have failed the exam. So there are basically two components. You have the long case and the short case. The long case, here you take the history and examination and make diagnosis. It is important that here you be very thorough. Do not leave any system on any system without asking the patient those questions, because the diagnosis may be in the system that you decided to leave out. So here, history of presenting complaint is very important, because that's what will help you to make a tentative diagnosis and to rule out other possible differentials. And your diagnosis must be explained by your history. Do not make a diagnosis that your history cannot defend. So it will be assumed that you just guess the diagnosis, not that you are making inference from your clerking. So in the long case also, you should know that examination is what will define what you got from the history, and you must be able to elicit basic findings. Let me give you an example. If somebody came in with heart failure, you should be able to get first, second, and third heart sound. If it's Gallop reading, you should get it. You should be able to know if the heart is displaced, if there is loud A2, if there is raised JVP. These are basic things that you should know. So you should be able to get elicit basic examination findings that will support your diagnosis. And when you make diagnosis, you need at least 3 differentials, right? So most students, what they do when they think of a particular diagnosis, they have no differential. So what if it's not the main diagnosis? What do you do? Okay, so it is important to have differential diagnosis. And please do not bring differential diagnosis from the out of the blue, right? It must be something that your history can defend, right? So don't bring out any differential that you just guess and the patient does not have any symptoms suggestive of it. Okay, so then you talk about the short case. Short case here is test your ability to examine a patient and make inference. So your ability to detect any abnormality on the examination. So it also tests your ability to inspect and observe striking things on the patient. So sometimes they will ask you, okay, what is obvious about this patient? Maybe the patient is in respiratory distress, or they ask you, okay, do a quick general physical examination. The patient may be wasted or having anemia, that's pallor. So you should be able to elicit quick examination findings and make inference. Okay, and it's also a way of assessing your examination skills, which shows whether you have been coming and been practicing examination of patient or you have not been coming. So that's the use of the short case. And in conclusion, so one of the most important things that you should carry out of this discussion is you should follow instruction. Do not do what you have not been asked. Do not do too much, especially during clinical examination, or too little. Some people do what they have not been asked, even in the AC, and some don't do anything at all. So do what you have been asked. Okay? Do not. So make sure that you all the tests, all the assignments, all the things that you have been given, all the tips that you are given, make sure you practice them. In the introductory end of posting exam, usually they ask you the things that they have taught you. Nobody will bring anything out of the blue. I hope this is of great benefit to you. Thank you.